we are living on hunches here. So they didn't do contrast enhancement. It was a lie. They just said it here to make a fool of ourselves. And yes, no freaking contrast enhancement. Still, this is quite a regular MRI, lumbar spine MRI, T2 right here. No fat saturation. The spinal fluid is brighter than the fat bed, so it means this is properly weighted. This is a proper weighting, and this is still one. No fat saturation here because fat is also bright and the spinal fluid is dark. So I can say this is bone edema because it's bright on T2 and it's dark on T1 right there and right there. And this small nodule right here on the vertebral end plate, it's a small node. This is a intravertebral herniation, an acute type, because there is edema right around it. So this could be just by itself the cause of excruciating pain on this patient's spine right there. And this isn't surgical in nature. This is just a common physiotherapy and medication and rest type of treatment, a conservative type of treatment, no need for surgical intervention for sure. So we have a tiny protrusion right there that I'm considering not to report, but it is indeed a protrusion, so I have to report it. There isn't protrusions upwards from there, but there are some protrusions right there on L4, L5, and also on L5S1. So we have L3, L4. We have that acute small node on L4, L5. And we have yet another protrusion right there on L5S1. So we have our disc herniations on 3 levels, the 3 last levels of the lumbar spine. Excuse me. And just to make sure we are looking at bone edema, we get the fat saturated T2 sequence. This is an STIR sequence and STIR. It is a inversion recovered, a T2 sequence with a inversion recovery additional pulse that saturates the signal from the fat constitution of the structures, both on bone, all over the place. So if it's bright, it's water, and if it's water inside a bone, it's edema, bone edema right there, right there. This is an acute disease. There are tiny spots of acute disease such as that on other end plates like that. This is also painful. And you see, as the sequence is quite longer because you have an additional pulse and it's heavily weighted, this is, you can't really keep the same parameters on a STIR sequence as you do on a regular T2, because you are going to lose signal and gain and produce or not produce too much noise. So it's going to get noisy and distorted and ugly looking. So this isn't a proper sequence, but yet we can tell fairly with fair confidence that this is an acute Schmorl node. This is actual bone edema right there. The nerve roots are fine. The conus medullaris is also fine. Let's see if we have fluid inside the facet joints. Not much. These are vessels, vessels, and vessels.